Hi. I haven't gone to exercise yet. I actually thought that while the going was good, I'd like to tell you how, the exam went. Um, because I really believe that the way I felt is exactly how a lot of people feel and how a lot of people will feel before, during, and after the exam. And I just want you to know that it's okay. Now, my background is, as you may be aware, I'm an international medical graduate. I'm a medical graduate with a difference, though. I am sure that there is no one who is as advanced as I am, in that I am 20 years post-graduation. So that's what I mean when I say advanced. I am 20 years post-graduation. I was living my life quite happily in another country, and life happens, and we made some decisions to move to the U.S. And it was not always in my mind to travel to the U.S. and live in the U.S. And so I didn't do the USMLEs before now. So this is why I'm sitting the exams this far away from my graduation. So I am here to give you hope and to let you know that even this far from your graduation, you can succeed and you can do well. When I started studying for the USMLE exams, I was trying to figure out which one I should start with. Should I start with Step 1? Should I start with Step 2? Should I start with Step 2 CS? And as a physician, I've been practicing medicine for 20 years. I decided that I would do the Step 2 CS first, because I've been in clinicals most all of my professional life, and that I would do that and get that out of the way. And because, of course, that was the closest to my experience. Step 1 is the furthest from my experience. I would have done Step 1 work about 25 years ago, guys. 25 years ago. So I thought to do Step 2 CS first, which would require less time in preparation and a better chance of doing something that I could do well in. It would give me confidence once I passed, which I did, and I can move forward. So I spent a lot of time preparing online in terms of YouTube. YouTube was a phenomenal source of information for me. I went onto YouTube. Laura Miranda, I believe she's from Costa Rica, or I believe it's Costa Rica. Please, I have to give her a great deal of thanks, because she helped me a lot in terms of my mental preparation. But not only that, but she came up with this fantastic idea of these things, these notes. Now, I'm not good at YouTube or uploading, but that's really hemateria. Not sure how it's coming through to you, but she came up with this idea, and I saw this on one of her videos, and then I created one myself, where I would have the clinical diagnoses, and then I would actually put on the other side the differential diagnoses and the workup. Yeah? So for example, for constipation or diarrhea, you could flip over, and then you would see what the differential diagnoses would be and the workup. Colorectal cancer, irritable bowel, and just all of them. I should also say that I did all of my studying from first aid. First aid, USMLE, Step 2 CS, the latest edition, and I had I think I had the 2013 edition. Let me get it real quick. Okay, I thought I had it right to my hand. Okay, I thought I had it right there to my hand, but I'm so sorry. It's 12 or 13. I believe I had the latest one. I went on to Barnes & Noble site, saw it there, and I went into Barnes & Noble and I bought it. So I find that this really, really helped a lot. Another thing that I did to prepare for the exam was I kept on writing out and I want to see if I can find it for you. I kept on writing out the patient encounter instructions. Now, I formulated my own patient encounter instructions. I know that American students have a different way of doing it. I did not follow their way. I followed First A's way, and a little bit of what I found on YouTube, and I crafted my own schedule. So that I said for my patient encounter, I'm going to look at the blue sheet for 1 minute, and I'm going to write on the blue sheet for 1 minute. I timed myself. I took my phone, I put it on timer 60 seconds, and I said, go. I read out a vignette, whatever it was, 25-year-old, blah, 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 with blood in your urine or whatever. And I said to myself, Ingrid, go. And I wrote on the blue sheet another thing that I got from Miranda, which was the mnemonics for past medical history. And I followed her thing on she has a video says blue sheet. And on my blue sheet, I put down, the history of presenting complaint with the LIQORAAA, location, intensity, etc. On the other side, I put the mnemonic for review of systems. Below that, I put past medical history, and in the right bottom corner, I put my differential diagnoses, my workup, and so on. So that was phenomenal. So on my blue sheet, that took a minute, and I timed myself when I was practicing. I would time myself to write that up, write down the mnemonics, and I would check, did that take 60 seconds? And it did. And history of presenting illness, review system, and past medical history, I put that it should only take me 6 minutes. Physical examination, I put myself to do that in 5 minutes, and closure in 3 minutes. So for a total of 15 minutes. Because it's 15 minutes for the encounter and then 10 minutes for the patient note. Okay? Then, in addition to that, along with that, I had things like the mnemonics and so on for certain things. Let me also say that I was working by myself. I studied from first aid, did a lot of YouTube examinations. I was not fortunate enough to have anyone to practice on even. I had my son, and so he allowed me to examine him twice. I would say, let me do a cardiovascular exam on you, a respiratory exam on you, a joint exam on you, and he allowed me to do it twice, 16-year-olds. So I didn't have that, but I went onto YouTube and I Googled, I typed in cardiovascular exam, lung exam, how to examine, neurological exam. I did that over and over and over and over. CNS, how to do a CNS quickly. I practiced. How did I practice? Well, mentally, I guess you could say. I kind of just practiced it. And when I did get the opportunity to examine him, I tried to take the opportunity to examine all of the systems and kind of went over that. I didn't feel very comfortable with that because I think I would have felt more confident if I'd had a chance to actually examine a patient. But I didn't have that opportunity. Since coming here, I haven't been working in any clinical setting. So that was that. So I did a lot of mnemonics, spent a lot of time on YouTube, and on the exam, I did my exam in Atlanta, and I got there 2 days before. And I did that because I wanted that if there was any delays in the airline, it would not have, if they had to cancel my flight and I had to travel the next day, that'd be fine because I gave myself 2 days. I got in, made myself comfortable, kind of put myself up in my room. My room is a really, really nice room. And I actually have a video of that. I may just upload that one, but my skin went, I was so stressed, my skin was horrific, and I'm a bit vain, and I don't know if I want to share that, but I may just do that. And spent some time just going over stuff. The next day I was panicked. I was so panicked that I had my lab coat on and my watch was on my hand, but it had slid down, and I had to run back up to my room. The shuttle was waiting. I ran up to my room looking for my watch, and when I looked, it was actually on my hand. And they don't really allow you to wear, not really, you are not allowed to wear your watch anyway in the exam. So I got to the exam center in the morning time. There were quite a few U.S. medical students. Most of them were U.S. medical students. And I think there was one other black female there, but everybody else was pretty much American, white students. I'm just giving you the demographics. That's not insignificant in any way. And they check your stethoscope, make sure you don't have any calculators, take your watch off, everything. They give you a number. And I really want to get to what happened when we actually got started. You have your cubicle, you put all your things in there, you just allowed your stethoscope, not even a pen, nothing. They gave you the pen, they gave you the clipboard. Anything you want to eat or whatever you put on your desk that they assign you to, and you go on from there. Now let me tell you, with the first patient encounter, my first patient encounter, I stood in front of the door and I had a mini mental breakdown. My mind left. I seriously blacked out, and silently, and I had to get myself together. I literally had to speak to myself to say, look, you're here now. You've just spent $1,400 for this exam, plus airfare, plus the hotel room. You have got to do this. Otherwise, all of that is in vain. All the time that you've spent has been in vain. And how long would I say that I spent? Honestly, I would say realistically, I spent about a month. Really good, solid, working hard, and then of that 4 weeks, 2 weeks solid, really hard at it. I can honestly say I didn't spend more time than that. I may have looked over the first aid. That's true. I actually went through the first aid before, but honestly, 2 weeks going over the patient notes. You know what's important too? Going onto the ECFMG site and checking the booklet for clinical skills and seeing exactly what they wanted. I actually printed out the five things that they're going to check on. Listening to the patient and outlining what you're going to do, and encouraging the patient to discuss with you their diagnoses and how they feel. I went through all of that. So for every integrated encounter that I did, I wanted to make sure that I incorporated those things that they were going to be testing me on. So I stood in front of the door, I freaked out, got myself in hand, I went in and did what I am accustomed to doing, to be honest. If you're a medical student, or if you don't have that background, I don't know. But I already had the background of talking with patients and being encouraging and stuff like that. So that part was really great for me. What I didn't expect was that everything I seemed to have learned would kind of run straight out of my mind in terms of how the Americans want you to do an exam. So I was there and I said, okay, you're not supposed to do long and hard. You're not supposed to do everything. You're just supposed to do a focused clinical exam. And I said to myself, when you get into the exam, do a focused clinical exam. So when I was in front of someone, I said, okay, this is what I'm thinking it's going to be. I'm going to do a focused exam. You're so tempted to do everything because you're following first aid, and that's the only area in which I would disagree. You're following first aid in that they do mucous membrane and they do ENT and they did do abdomen and stuff like that, when they're not asking you for that. And I had to put myself in hand and say, you may fail this exam, but you're going to do what ECFMG says that they want you to do, which is focused. So I focused, and if it were just head, I did head. If it was just abdomen, I did abdomen. If it was just big toe, I did big toe. If it was just living room, whatever, whatever it was, I focused on that. And let me tell you how things went. So I freaked out. My very first guy was pretty easy, but I realized he was easy when I got in front of door number 2. Yeah. Just to let you know, I got out. The encounter went well with the patient. It was wonderful. I completely missed the diagnosis. Yes, I did. Sat down and wrote nonsense. Completely forgot to write down the workup. Completely forgot that. And as I think, made a mess of it. I got in front of step 2 and I got in front of door number 2 and had another mini meltdown because I stood in front of door 2 and then thought, oh my God, that was a diagnosis for the, oh my God. But remember what they say in first aid. Once you finish the encounter, what's the point of freaking out? But I did. So I'm just telling you, I'm being real. I freaked out in front of door number 2 rather than trying to calm myself. So I had to get myself together there and said, that's in the past. And so some of the encounters, when you're writing the patient note, my strategy, because again, I was all about strategizing for this 10 minutes. When I got in front of the patient note, I trained myself to go directly for workup and differential diagnoses. Yes, I trained myself to go differential diagnoses and the workup. So why did I forget that in patient number 1? Because, as I said, it was all a freak out thing. So I said, you know what? Learn from that. You know what to do. Do what you have been training yourself to do. So when I got out of the second encounter, then I went straight for the workup because I'd forgotten it in patient number 1. Wrote down quickly, you're typing differential, so that you at least have something there that is definitive. You know what you're working with. Then I went straight up to then the HPI, history of presenting illness. And I put HPI, and I put review of systems, past medical history, past surgical history. And I actually wrote that down before I filled in any of the details. Family history, allergies. I did all of that so that I would just have to kind of like fill in. And so I just filled in the blanks. Then review systems, negative except as above, family history, social history, whatever, medications, etc., etc. Then the physical examination. Honestly, I can honestly tell you with physical examination, this was where I was scared the most because it's a patient encounter, and I would say that most of the time they seem to have found people who actually had the thing that I shouldn't even say that. That's not necessarily true. That happened in a couple of times. The people could have been simulating it. But then when it came to the patient note, in terms of writing the physical examination down, that was where I wasn't certain. So I wasn't really certain about that. I kind of wrote what I found, and negatives, writing down that negatives is important. Then when it gets to differential diagnosis and findings, that too, I wasn't really sure what to put there, because sometimes you're going to have any findings, For the main diagnosis, you may have one finding, but for the others, then nothing. So I was a bit, concerned about that. After patient number 5, you have a break. And then they have a really lovely spread of stuff. Food. It's not only sandwiches, but it was food. They had drinks, they had coffee, they had tea. They had soup. I looked at it and I saw all of the students, and they were just planning on their place, and they were having a good time, and they were eating and stuff. I couldn't eat one thing. I said, okay, it's a long day. So I forced myself to pour some soup out. I took a few sips of that. Drank some water. Drank some juice, I think, too. Just to be able to go on. But I was actually running just on nerves. The second part, you had 4 patients. Is that how it goes? 5, 6, 5. Yeah, right. Because then the next break, At the first break, then you have 4 patients after that break. And so we did those 4 patients. And what I found was I just got into rhythm of forgetting what was before. Once I finished that, that was that. Forgetting that, going right ahead, getting to the next one. Most of the time, I would say, once I got into the rhythm, I was actually coming out of the room before the time. There was one time when I actually was in the room and I heard the encounter is now done. Oh my God, that was like, it's so horrendous. You're like, your heart was like, my heart was like, oh my goodness gracious me, I'm going to die and expire right here. That happened one time. I would say quite a few times while I was still typing. The time would be up, but because I had ready, differential was already there, workup was already there, and I had already put the headings for what I wanted to do, and I put a little bit in each. Meds, none, put a little bit in something so that you have something there. And I made sure that I got the history presenting illness there to tie into the differential diagnosis. Once you do that, it worked out as you know now, as I know now. But I will say the difference between American students, which I had even heard online on YouTube, was that they knock on that as soon as they say, prepare. You may now begin your encounter. They slide that door, and they're in like 10 seconds. And I think I got that from Miranda as well, Laura Miranda, where she said that American students they would just go right in. I heard them doing that, and I was determined to stick to my plan. Remember what my plan was, which I can't find right now. My plan was to do what you train yourself to do. 1 minute. You are going to spend a minute of your 15 out here getting yourself together, writing up your blue sheet. And I did that. The American students were in, and 99% of the times once I came out, they had already been out maybe a couple of minutes. So actually that informed me too, because I said, you know what? I may still be spending too much time in here. I may still be spending too much time in here. And their pass rates are very, very high. So why am I spending that much time? Make sure that you get involved with the patient, show empathy, do a focus exam and come out. Focus exam, come out. And so that kind of informed me a little bit, but I didn't want to look at what they were doing. I wanted to do what I was training myself to do. And I would come out, but they would be typing away. And is there anything else I really want? The proctors are very nice, very helpful, serious people, but very, very nice, straightforward. And no one had any issues. We didn't see anybody having to be told to stop or any irregular behavior, nothing like that. Everything went smoothly that day. And I came back to my hotel room. Luckily for me in Atlanta, where I was, they had a shuttle which took us to the exam and back. It was really wonderful. Got back to the center, felt absolutely horrible because I just kept on remembering my patient number 1, where I felt that I had messed up completely and royally. And I then allowed myself to really begin to feel the pressure of the day. And I went into the bathroom and cried. Just cried and cried and cried and cried and cried. Cried and cried and cried and cried and cried. When everybody wanted to know how the exam was, I kept on saying, how was the exam? It's over. It's done. I don't want to talk about it. And for a while, I felt badly. Then, kind of like maybe about 3 weeks after the exam, I started to feel more hopeful. I started to say, look, did you really do all that badly? You have to pass 75% of it. Don't you think you would have been able to pass 75% of it? And I'm thinking, you know what? Maybe it's not as bad as I thought, which is interesting. You would think the further along you go, you may be feeling worse. But I actually started to feel better about the exam the further I got away from it. But right after the exam, like the first couple of weeks, I wasn't very hopeful. And then coming up to the latter part, while I'm just waiting to get that email, I started to feel in between, and I started to say, look, it doesn't matter whatever happens, it happens. So I just want to say, you can do it. If you have a study partner, great. If you don't, you can pass. If you are working in the clinical field or you're not, you can pass. If you are 5 months, 20 months, 20 years from medical school, you can pass. So I'm going to be preparing now, or I'm preparing now for step 1. I'm planning to do that in 8 months. And I'm planning to do it in 8 months because I am so far away from any kind of step 1 stuff. 25 years to be exact. And so this is going to be an encouragement to someone who is 6 years, 7 years, 15 years, and they're thinking that they can't do it, because I intend to pass step 1 as well, and I intend to pass it the first time, because I don't like to repeat exams. I honest to God really hate to. It's not the finances only, I hate to repeat them. So I don't plan to. I plan to work really hard, and I'm not sure if I'll post how I'm studying and stuff. It depends, you know. I don't have a channel or anything. This is really just to help someone have confidence that, oh my God, will I pass my exam, or I've done my exam and I don't think I did well. Prepare, have a plan, follow the plan, execute the plan, and then leave it in God's hand. That's as much as you can do. Just do the best that you possibly can, and I believe that you're going to succeed. So congrats to me. I did pass, so I'm so grateful that I did. And stay tuned for my other videos, which I'm going to be uploading maybe from my hotel room. Depends on how I feel. Alright, talk to you later.